Hello everyone, welcome back to Nursing Simplified. In today's medical surgical nursing lecture, we will discuss an important ENT disorder called nasal polyps. Definition of nasal polyps. Nasal polyps are soft, painless, non cancerous growths that develop from the mucous lining of the nose and the paranasal sinuses. They usually result from the chronic inflammation and may occur singly or in clusters, maybe in one nostril or generally in both the nostrils, which obstructs the airflow. Anatomy of the nasal cavity. The nasal cavity and the paranasal sinuses are lined by a mucous membrane. In this nasal cavity, so nasal septum divides into two nostrils, right and left, and continuous inflammation causes swelling of this lining, which can eventually form polypoid growths. Polyps commonly arise from the ethmoid sinuses. Causes and risk factors. Chronic inflammation of the nasal mucosa, recurrent infections, frequent infections, and allergic reactions, asthma related conditions, sinusitis, genetic predispositions, or chromosomal abnormalities, environmental irritants like pollen, dust, smoke, pollution, and chronic rhinosinusitis, allergic rhinitis, and aspirin sensitivity may cause nasal polyps. This is the image of a nose where there are nasal polyps. These are polyps present within the nasal cavity, and these polyps obstruct the airflow. Pathophysiology. The chronic inflammation leads to edema of the nasal mucosa where fluid is accumulated. The swollen mucosa gradually protrudes into the nasal cavity, forming polyps. As they enlarge, they obstruct the airflow and sinus drainage and causing various symptoms. Clinical manifestations: nasal blockage or obstruction, persistent nasal congestion, runny nose, postnasal drip. Postnasal drip means when more mucus than normal gathers and drips down back the throat, then we call it as postnasal drip. Reduced sense of smell, anosmia, which means loss of smell. All these are clinical manifestations of the condition. And sometimes we can also observe there is severe obstruction in the nose. So there will be mouth breathing, snoring, and sometimes maybe due some sinus infections are also be visible. Diagnostic evaluation. Diagnosis is based on patient history and physical examination. Nasal endoscopy helps in visualize the polyps directly, and CT scan of the sinuses may be performed to determine the size, location, and extent of the disease. Allergy testing is done in case of allergy suspect, and assessment of airflow and air passage is to be done. These are the common diagnostic tests that can be performed in case of nasal polyp suspect. Medical management. Corticosteroids are used to reduce inflammation, and generally this medical management aims to reduce the inflammation and to shrink the polyps. The corticosteroids are used to reduce inflammation. Corticosteroid nasal sprays are also be available and are commonly used. Oral corticosteroids can also be prescribed in severe cases. Antihistamines are used to block the histamine release and reduce the allergic reactions. Example, cetirizine, loratadine. Decongestants are helpful to relieve the congestion in the nasal cavity. Pseudoephedrine is the example of nasal decongestants. Antibiotics can be used in case of any presence of any infection. Best choice is amoxicillin. Saline sprays, example, normal saline drops are used to loosen the secretions and to keep the nostrils hydrated. Moving on to the surgical management, when symptoms persist despite medical therapy, then the surgery may be required. Polypectomy. To remove the polyps present in the nasal cavity is called polypectomy. Ectomy means removal. Removal of polyps is called polypectomy. And endoscopic sinus surgery is most common procedure that can be done in case if the symptoms still persist and if the condition is not resolved through medical management, and it improves the airflow, reduces the recurrence of this infections, and if any medical treatment fails, then the surgical management is done, and the goal is to remove the polyps and to restore normal sinus drainage and airflow. That is the reason they, they perform endoscopic sinus surgery. Nursing management. Nursing management is really very important. uh, Such conditions, and for this ENT nursing, so nursing management, so nurses should assess the respiratory status, monitor the nasal obstruction breathing pattern, administer the medications as prescribed by the doctor, and educate the patient regarding the treatment adherence and nasal hygiene, and encourage the patient to take adequate hydration, to maintain adequate hydration, and to provide um, and has a nurse has to provide the emotional support to the patient in the family. Pre-operative and post-operative care. Before surgery, explain the procedure to the patient and reduce the patient anxiety by explaining the surgical procedure in a simple way. And preoperative assessment has to be done, and consent is to be taken from the patient or the family. And after surgery, monitor for bleeding in case of presence of any bleeding or pain or any infection, and how we check the airway patency after the surgery. Teach the patients to avoid nose blowing and also maintain nasal packing if necessary, and follow the post operative instructions carefully. So, these are to be told and advised to the patient post operatively. Complications. If the nasal polyps is left untreated, then that may cause chronic sinusitis, recurrent infections, sleep disturbances, mostly due to nasal obstruction and or obstructive breathing problems, reduced sense of smell, and decreased quality of life. Sometimes polyps may recur even after treatment. These can be the complications of nasal polyps. Patient education. Patient education is really very important. So, what the patient has to be educated. The nurses should advise the patient to avoid allergens or irritants and maintain good nasal hygiene, use medications regularly, and manage asthma or allergies effectively, practice nasal irrigation, recognize early symptoms, and attend follow up appointments to reduce the recurrence. Prevention. How to prevent these nasal polyps? By controlling the allergies, by avoiding the exposure to the allergens, and treating the infections as early as possible, maintaining good hygiene, very particularly nasal hygiene, avoiding exposure to pollutants, smoke, and using humidifiers so to keep the nostrils, the airway moist. To summarize, nasal polyps are benign inflammatory growths of nasal mucosa. Early diagnosis, proper medical management, surgical intervention when needed, and patient education are essential for successful outcomes. Thank you for watching this lecture. If you found this video useful, please like, share, and subscribe to Nursing Simplified for more medical, surgical nursing, and ENT nursing lectures. Happy learning and stay safe.